This is Danny Blythe with Weibi, or wilting impediment. Please pause and read this. Remember, this is for acupuncture students only. Wei means wilting, and in this context refers to weakness of the limbs, limpness, atrophy, or loss of function. And B is the same B as in B syndrome, and means impediment. And this was first talked about in Suwen 44, where there were 5 types of Weibi discussed for the 5 elements. What was interesting about that chapter, where they talked about treating the Yang Ming channels, which are full of qi and blood, and they also talked about treating the Chong, the Dai and the Du Mai, which are important in terms of the involvement of the kidneys. So these symptoms can vary from weakness at the very mild end through flaccidity, atrophy, and into motor impairment, loss of muscle reflex, and paralysis at its most severe. The kind of Western diseases that get referred to in Chinese medicine as Weibi include things like multiple sclerosis, poliomyelitis, myasthenia gravis, muscular dystrophy, and motor neurone disease, to name just a few of them. And the muscles and sinews are nourished and moistened by the jinie, the body fluids. They're moved and warmed by the gu qi, and they can be obstructed by damp or phlegm and by stagnant qi and blood. Wei syndrome is a disease of the body fluids, like the wilting of a plant, and it's a disease of the gu qi, so there's not enough qi getting through to activate the muscles. So we have to ask ourselves, what injures the body fluids and what injures or blocks the gu qi? The fluids can be not nourished because the liver and kidney yin are deficient. We tend to see this in later stage Wei syndrome, slow onset, motor impairment, atrophy, and then the typical yin shu signs and symptoms. The body fluids can be injured by a warm disease, so this tends to be to injure the lung and stomach yin, the more superficial yin. So with this we see flaccid muscles, we see some motor impairment, a history of a fever, dryness signs and symptoms. We often see this with polio and other viral infections, so this is essentially a warm disease invading, or sometimes we see it as a lingering pathogenic factor. The fluids get obstructed if there's damp or damp heat. Remember, dampness is essentially a thickening of the body fluids. So we see the body being heavy and weak, numbness, the legs can get hot and swollen if it's damp heat, or if it's cold, the legs can be cold, weak and flaccid, and then the usual signs and symptoms that we'd expect of dampness, so heaviness, muzzy head, bloating. If the blood is obstructed, then that obstructs the body fluids. So the limbs can get numb, weak and painful. If the spleen and stomach qi is weak, then the gu qi isn't supported and it's going to be weak. So we see weak legs, the body's hard to lift. We see general spleen qi deficiency signs and symptoms, poor appetite, weakness, tiredness. Can also be scattered by shock. So we see the syndrome of heart, blood and spleen qi deficiency in relationship to a sudden shock, which involves Wei syndrome. Acute patterns of atrophy that we see are heat in the lung due to injury to the lung fluids. So this is where external pathogenic heat invades. We get a fever, which then injures the body fluids. So we see symptoms of the body fluids being deficient, such as weakness, flaccidity of the limbs, dry mouth, dry skin, thirst, dry cough, dry throat, dark urine, dry stools, and also the shen disturbed by this heat, so mental restlessness. Pulse will be floating empty or thin and rapid. The tongue will be red and peeled, perhaps with a yellow coat. Another possibility is invasion of damp heat, in which case we get typical damp heat signs, a constant low-grade fever which doesn't go with sweating. The legs are heavy and swollen, possibly hot to the touch, depending on how much heat there is. The body's heavy, the urine's scanty and yellow, and the feet feel hot. We also might get some damp signs if there's less heat, so numbness, edema, feeling of stuffiness or oppression in the chest, epigastrium or abdomen, which people normally feel as like a blocked sensation, cloudy urine, and we get underlying spleen qi deficiency, and as it becomes more deficient, more of this manifests. So with weakness, pulse will be slippery and rapid, tongue will be sticky yellow coat. Finally, there might be an invasion of pathogenic damp and cold. If we get a damp, Cold invasion, we see cold, flaccid limbs, heaviness, dizziness, blurred vision, back and shoulder pain, and numbness at the back. And again, we might see spleen Qi deficiency with the signs of weakness. Pulse will be deep and slippery, tongue pale white, sticky coat. Deficient patterns we see are spleen Qi deficiency. We see muscular weakness, weak limbs, especially the legs that are hard to lift, tiredness, poor abnormal appetite, loose stools, pale complexion. The pulse is deficient, the tongue will be pale, quivering, swollen, and might have transverse cracks. We have spleen and heart collapse, which is said with spleen Qi deficiency, and heart blood deficiency, which happens after a shock. So we get signs of spleen Qi deficiency, such as the poor and abnormal appetite, white complexion, loose stools we just talked about. We also see signs of heart blood deficiency and Shen disturbance. So we get palpitations and insomnia. This we see in the later stages, liver and kidney yin deficiency. So this is more slow onset, weakness and atrophy of the muscles, especially the legs. So we get symptoms of kidney yin deficiency, such as the weak back, tinnitus, poor hearing, incontinence of urine, exhaustion. We also see signs of liver yin deficiency, so blurred vision, dry eyes. Pulse will be floating, empty and rapid. Tongue will be red peeled and cracked. Finally, we can get blood stagnation in the channels, which again tends to happen at the end stages. So long-term yin and blood deficiency are usually the cause of this. Numb limbs, weak limbs, painful limbs, bluish tinge to the limbs or obvious veins, and withered lips from the dryness. Pulse will be deep thin with some choppiness, and the tongue will be showing signs of purple. Schematic gives you an overview. Things normally start as damp heat, damp cold, or a wind heat injuring the fluids. Damp heat and damp cold will tend to injure the spleen over time and lead to more spleen Qi deficiency as it becomes more chronic. Wind heat injuring the fluids will deplete the liver and kidney yin over time. And any of these patterns can gradually become blood stasis, but it tends to be blood and yin deficiency leads to that end stage blood stasis. Thanks for listening.